Epilepsy is a central nervous system disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Anyone can develop epilepsy. Epilepsy affects both males and females of all races, ethnic backgrounds, and ages. Every function in the human body is triggered by messaging systems in our brain. Epilepsy results when this system is disrupted due to faulty electrical activity. Seizures are the main symptom of epilepsy. Symptoms differ from person to person and according to the type of seizure. Doctors aren't sure what causes epilepsy in most folks, but there are conditions that affect the brain that can make it more likely that you get seizures, such as severe head injuries, stroke and blood vessel diseases, tumors, changes in brain structure, or brain infections. The symptoms you have depend on the type of seizures you get. During a seizure, you might stare into space, get confused or be unsure of where you are, pass out, jerk or twitch your arms and legs, make other unusual movements, or just feel strange in general. These problems can last from a few seconds to a few minutes. Most people have the same symptoms each time they have a seizure. Your primary care doctor will most likely refer you to a neurologist, and you may get an exam where your doctor will check your walking skills, your reflexes and coordination, your muscles, senses, and syncing ability. Other tests your doctor might suggest to find out if you have epilepsy include EEGs, CT scans, blood tests, or an MRI. To get an epilepsy diagnosis, you must have had 2 or more seizures at least 24 hours apart. Once epilepsy is diagnosed, it is important to begin treatment as soon as possible. For about 70% of those diagnosed with epilepsy, seizure can be controlled with modern medicines and surgical techniques. Anti-seizure drugs are the main way to control epilepsy. Which medication you get depends on the type of seizure that you have. If the first drug you try doesn't work, your doctor will switch you to another one. Surgery could be an option if the medicine doesn't control your seizures or if your seizures are caused by a brain problem like a tumor or a stroke. Globally, an estimated 5 million people are diagnosed with epilepsy each year. In high-income countries, there are estimated to be 49 per 100,000 people diagnosed with epilepsy, and in low and middle-income countries, this figure can be as high as 139 per 100,000 people, according to the CDC. This is likely due to the increased risk of health conditions, road traffic injuries, birth-related injuries, increase in populations, and variations in medical infrastructure. Close to 80% of people with epilepsy live in low and middle-income countries. Studies show that epilepsy is more common in males than in females. Studies also found that the prevalence of epilepsy was slightly higher in males than females, 6.5 versus 6 per 100 people, but the risk for recurrent seizures is similar between males and females, as is the likelihood of ultimate remission of epilepsy. Although most epilepsy syndromes are most equally or more commonly found in males than in females, childhood absence epilepsy and the syndrome of photosensitive epilepsy are more common in females. One seizure does not signify epilepsy. Up to 10% of people worldwide have one seizure during their lifetime. Epilepsy is defined as having 2 or more unprovoked seizures. Epilepsy is one of the world's oldest recognized conditions, with written records dating back to 4000 BC. Fear, misunderstanding, discrimination, and social stigma have surrounded epilepsy for centuries. The stigma continues in many countries today and can impact on the quality of life for people with the disease and their families. Although the social effects vary from country to country, the stigma and discrimination that surround epilepsy worldwide are often more difficult to overcome than the seizures themselves. People living with epilepsy can be targets of prejudice. The stigma of the disease can discourage people from seeking treatment for symptoms, so as to avoid becoming identified with the disease.